Good afternoon, and it's Monday, the 23rd of August, 2021, and another Government of Anguilla press conference. I give apologies for the other members of Cabinet who are finishing up meetings and who will be here shortly. I want to welcome the Chief Medical Officer, the Permanent Secretary in the Ministry of Health, welcome Radio Anguilla, the Anguillian, the Daily Herald, Dites, Lloyd Live, and Mr. Pickering from KCN News Channel 4. Welcome again. Before we get started, I'll lead us in a word of prayer. Please bow our heads, close our eyes. Father in heaven, we want to thank you for this beautiful day. We want to thank you for the blessings you have bestowed upon us as a people. We do know that right now we are dealing with clusters of positive cases of COVID-19. And Father, you've been good to us throughout, and you'll continue to be good to us as we deal with these cases. Those who are sick, protect them, keep them, and prevent them from severe illness, dear God. And we ask that you give us the wisdom and understanding so we continue to follow protocols and continue to make the necessary regulations that we can protect our people. We ask that you look down upon us and help our economy also, dear God, because you know that it is necessary that we be able to survive through this time. Those in the region and the world, dear God, as we all grapple with this plague, that you help us to come through it. The vaccines, as they get authorized, dear God, that those who have not gotten them as yet would feel the need to become vaccinated, because that's the best way that we can get through this, dear God. We ask that you continue to be with us, give traveling mercies to those who are coming, bless those who are listening by whatever means, and we ask that you be with us and that the words that we speak would be enlightening to others. In Jesus' name we pray. Amen. All right, since I said so much, I will turn over to the Chief Medical Officer and the Permanent Secretary and the Ministry of Health to bring us the COVID update, vaccinations, our protocols and regulations going forward, which I know that we have some regulations which come into effect today, 23rd August. Thank you.
Okay, so I'll begin with the usual update in terms of the cases. Our last update was Saturday, and then we had recorded 166 confirmed and 31 were considered active at that time. So on Sunday, we confirmed a few more cases, 6 additional cases, and they're as follows. Another cluster was identified, a cluster of 5, this time from a hair salon, a hairdressing salon, consisting of 2 fully vaccinated adult females, 1 unvaccinated female, and 2 unvaccinated children under 5 years of age. But however, from that cluster of 5, 3, including the 5-year-old child, are considered recovered at this time. When we tested them, they were just about negative, and from the information we got, they were infected a couple of weeks ago easily. So just to share that. Another contact related to the bank employees and non-workplace contact also tested positive yesterday. She's an unvaccinated female contact. And then we had 1 unvaccinated female with no history of travel for whom the contact tracing source investigation are underway, because it just occurred, I think it was Saturday night into Sunday morning. And then we had 1 unvaccinated minor resident returning resident who tested positive upon arrival. And just in a correction from yesterday, I mentioned that they had 2 minors under the age of 10. Actually, only one of them was under the age of 10. The other is a 14-year-old boy. So additionally, the hospitalized case we mentioned, she was in fact discharged later on Saturday. That's a fully vaccinated adult female with the underlying risk condition for severe COVID, doing quite well. We shared in the press release that she was admitted for respiratory complaints, but of course, naturally, the doctor said similarly, it was as much for her underlying condition, which kind of got destabilized naturally, as happens when people get infected and so on. So, of course, the threshold for admission was also lower, a good medical practice. She's doing well, so she spent overnight in the hospital and has been released already. And so the contact tracing and investigation continues. We've also had an additional 7 recoveries since the report of Saturday, including another 5-year-old child. Additionally, one gentleman who was an imported case, caught on, I think it was arrival testing, he was able to repatriate to the States yesterday on private jet, private charter, which is totally permissible by IHR regulations and so on. So that brings us today, since the beginning of the pandemic, to having confirmed 174 cases and with 28 active on island at this time. Looking at the vaccination status, which has stalled for obvious reasons, we have 58% of our estimated population of 15,500 considered fully vaccinated, and then 61% have received at least a first dose. So just looking more closely at the 41 cases that were of local transmission, really, just to say, August has been a very busy month for us. We actually confirmed 54 cases in August. A lot of these have been breakthrough infections and so on. However, focusing more narrowly now on our local situation, that's 41 cases involved in some local transmission one way or the other. Just to share that 26 of these are females, 63.4%, and then 15 are males, about 36.6%. In terms of vaccination status, we have 70.1% of them are fully vaccinated, 29 of those, and 29.2% are unvaccinated. Among the females now, 73% of the 19 females involved are vaccinated, and 10 out of the 15 males, 67%, are fully vaccinated. Looking a bit at the age range, we have the youngest from yesterday is a 1-year-old male. The oldest is a 65-year-old female. Majority of persons, 60.1% or 25 of them, are between the ages of 30 and 49. We have a few minors, 5 minors involved under the age of 18. 2 of them have fully recovered already, the 2 5-year-olds. And you'll notice lately the general trend in terms of the elusiveness of the sources of infection. We continue, and we've shared a couple of theories on that. What we have found over the last few instances is that the persons that we are picking up first are not the persons who have been infected first in the chain of transmission. So it's made it a little bit more difficult to say, okay, where exactly the person got infected from. We're doing the contact tracing. The contact tracing is picking up persons in their circles that were infected before. So just to clarify that. What we are seeing overwhelmingly, as the Premier mentioned, this is really clusters, a lot of clusters. That's good, that's much better than dispersed, a lot of cases popping up all over the place, albeit the elusiveness of sources of infection. What we're seeing a lot of clustering. Household clusters, tiny household clusters, but also 4 main clusters, for example, identified at the workplace, which are also arguably small clusters, and then extending from that, the contacts of those cases and so on. So looking at the clusters, the 4 main clusters, including the resort, food and beverage, the tiny bar, the hairdressing salon, and so on, that actually accounts for 30 out of the 41. So 73% of cases in some kind of connection to each other, right? So in terms of how the epic curve looks, because when you implement measures and you want to decide whether to go harder and whether you need some kind of more imposing measures, we feel at this point comfortable with the approach so far. Just to share, the most we have that have tested positive on one given day is 6. That's a far cry from what happened with the cluster when we were basically unvaccinated and we had to have a hard lockdown. We saw 16, 22, a double digits on many days in terms of positive cases. So we're seeing that. Another pattern that has emerged in terms of, in addition to the clustering and the linkedness of cases, right, is that several instances have involved persons going back to work in the work environment with symptoms. That happened overwhelmingly on the weekend. The person that came in said, everybody was this from the home and they're involved in the business and they were all unwell, and true to form, they tested positive, although they could be seen to be at the end of infection. We have to impress upon the public, please do not report to work if you're having any of the symptoms, anything respiratory at this point in time, you're feeling unwell, let us clear you. Symptoms have ranged from mild runny nose, scratchy throat, headache, flu-like symptoms, right? Loss of taste and loss of smell as well in the mix. So if there's a doubt, please do not show up to work. To be fair, the persons, I think what was happening in this last cluster, maybe there was a couple of weeks ago when the picture was being uncovered, so we're not saying that persons were deliberately trying to infect other people at this point. We're expecting that we will not hear any more such reports going forward of persons just coming to work when they are ill. And we continue to screen a lot of persons. I think anybody who thinks they may have been exposed, just to share that since the 8th of August, when we really started seeing the local transmission, we've screened over 460 persons. Again, it's a testament to the, we're quite heartened by the limited transmission thus far, knock on wood, and we celebrate the moments as we see them. So that has been comforting. So we've screened over 460 persons in this effort. People are calling and people are coming in, and so that's very good, and we'll continue same. I think I'm going to pause there in case there are any questions.
Thank you very much, Dr. Andrew. So what we have seen now is Can you hear me now? Thank you. Just to follow up on a couple of things that the Chief Medical Officer mentioned, we are heartened by the fact that we do not see the quick spread that we saw back in April. As she mentioned, we are now into almost a third week. Monday will make the third week we're in. And certainly by the first week of the initial spread back in April, we are already up double digits, triple digits, and by the end of the first few days. It's taken us almost 3 times that period to get up to where we are now. I think we want to, of course, still ensure that members of the public come in, they call in when they have symptoms so they can be tested. That is critical for us to stop the transmission, so that we can isolate persons, as indicated on more than one occasion. Our strategy still depends on early identification, isolation, treatment. That's it. And the earlier we can identify persons, the better. So if you're feeling sick, as the CM has indicated, please don't go to work. In some instances, the symptoms have been so mild, people have basically felt that it was like a sinus, a minor flu, and they didn't even equate this with COVID at all, because the symptoms were so minor. And again, that is because of the impact of the vaccines on persons who would have contracted it. So what we're asking you, even if you feel it's not too serious, once you have certain symptoms, please don't go to work and call in to be tested. The earlier you're tested, the better for everyone involved, whether we can rule you out, or if there's need to do further contact tracing. We again would like to inform persons in Anguilla that the regulations for masks are still in place. If you're in indoor places, you cannot social distance. It is the law of the land right now that you must wear masks. That is critical. And what we've indicated as well, if you're also into intergenerational, multi-generational households, it's critical that you wear masks as well, so that you can protect each other. And I think we don't want that message to get lost. It's critical if you're indoors, poorly ventilated areas, closed quarters, that you wear masks and that you social distance. And there are regulations in place based on that as well. We're also requiring that persons, once you are either tested or placed in quarantine, please stay in quarantine until you're cleared. That is very critical. Even if you have not yet been tested positive, there are some people who will not test positive on the first test. We have to test you again to rule you out, whether it's 5, 6, 7 days or 10 days after. We have to test you a second time. So if you're placed in quarantine and you got a negative test, but you've been placed in quarantine, please stay in quarantine. Do not leave because you're feeling well. Do not leave because you have that negative test. There is a protocol we're working with, and it's critical that you stay quarantined until you're cleared by the quarantine authority. That again is regulations. You cannot leave quarantine unless you're cleared by the authority. If you do leave before you're cleared, that is a breach, and you're subject to, it's an offense, and you're subject to either penalties, imprisonment, or both. And certainly, what we've done in the past, persons who have breached quarantine, we do not let them go back home to quarantine. We take them to HMP West so they can stay out there, quarantine there. Because if you have an affinity to break the rules, then certainly we can't have you be risk in the community. So we ask you to stay home. Please, even if you test negative on the first test, stay home until you're cleared by the quarantine authority, because we have to run more than one test on some persons. You would have been privy to the new measures that will come in place today, and certainly that again is recognition of the fact that we feel the risk right now is persons entering into the community. Whether you're visitors coming in, excuse me, Premier. Whether you're coming into the community to reside in a community, we think that is a risk right now. So we have indicated what those are. We now have the regulations in place for that. As well, one of the changes we made, a part of phase 2 de-escalations that should have begun the 1st of September would have been to roll back quarantine to 7 days for persons who would have been not vaccinated, but we have indicated that that will stay for 10 days. We're not going to roll that back to 7 days anymore until further notice. And October 1st, phase 3, at this time we will continue the entry requirements, testing on arrival, application to arrive, and those type of things. So because of what was happening globally now, we think we have to take a step back and look at certain things differently. So that is where we are right now, Premier, and if there are any questions or clarifications, we would take them now.
Good afternoon. Dr. Andrew, you mentioned what we're seeing now is perhaps a breakthrough in vaccines. And I wanted to know, for instance, in those cases where the person might not have any travel history, would you say that perhaps that person may have a breakthrough in the vaccine where they have tested positive? So now we have cases where the vaccinated are infecting those who are vaccinated.
Well, the whole definition, the idea of the breakthrough infection is that in persons who are vaccinated, you still end up testing positive later on. There's evidence of the virus in your system, as it were. And it draws back to what we were saying, that the first objective of the vaccination program and these vaccines in the first place was, first and foremost, to prevent severe disease and death, right? So that was the first objective, and they're still doing that despite Delta. We got a little excited later on because you saw drastic reduction in transmission and whatnot. People who are infected with Delta are still, in fact, and vaccinated are still less likely to transmit the virus for several reasons, including a shorter infectiousness period, but not as much as with the previous strains. So it is more infectious even among the vaccinated, right? So yes, there is a possibility that vaccinated persons can become infected. To the extent that they are infecting other persons, it's going to still be less than with the unvaccinated persons. But yes, we have to acknowledge that that is obviously a possibility and most likely what's happening, because we can see that they are getting as high viral loads, vaccinated persons, as persons who are unvaccinated. However, a huge difference is that the period of infectiousness is much shorter one, and the verdict is still out on how much they're able to transmit. It is seen that persons who, they're still doing the tests and so on to see how much of a reduction there is. We're seeing is not as much as with the other viruses, clearly, because you're seeing more breakthrough infections with Delta, and you're seeing those low viral loads, so you have to say, well, there must be some transmission occurring here. So that was always a possibility. Delta has shown us a curveball because the other virus, the other variants were less transmissible, as it were. But in terms of the objective of preventing severe illness and death, I mean, really and truly. I know one epidemiologist actually said on the weekend that we need to adjust our idea of success and let us not be handicapped by certain notions, because we really, up to now, this is good news still. That said, I'll take the opportunity to assure the public we are not playing with Delta. We are not being complacent. It's nothing to play with. We've seen other highly vaccinated populations have waves and waves and waves and waves. Yes, you don't have as many people dying who are vaccinated and whatnot, but still there's that risk. The more disease you have, the more chance you're going to see untoward outcomes. So we are still being very careful. We still have a significant segment of the population that are vulnerable, and we are trying to address those specifically. But we are really trying to see the way forward in dealing with this, because we have a few months of this left. So today, there's a lot to celebrate still. And imagine if this had hit us, and this is most decidedly Delta. If this was Delta like a few months ago, we would be saying something very different. We'd probably be in a lockdown. Definitely would have more people at the hospital by now, most assuredly. So we are seeing a lot of what the textbook has said about these variants and the vaccine.
There has been some criticism that we haven't shut down and locked down the country. I mean, we are at a very different place now than we were in April. Very different place than we were in April. And our first inkling is never to lock down. We lock down if we have to, like we did last time, because we knew the vaccination rates were low, and we knew that it would have been beneficial for us to have an idea of what was happening. This time is a whole different ballgame. We have seen the numbers, and even though in a couple of cases we're not too sure how people got infected, we still have seen the numbers, and they're basically going to increase gradually. If you recognize that as of today, we were able to take about 12 people who have recovered off the list, who were infected about a week, or maybe a little over a week ago. So our numbers now, active cases as of now, is 28, right? So we still at a point where we are managing in a way that doesn't need us to shut the country. So we're hoping that people understand. The ministry only recommends shut to Executive Council if there is a need, and there is certainly a threat to life and a threat to the economic development of Anguilla. At this point in time, we feel shutting the country down would have more negative impacts to the health, not only to the physical health, but also to the economic health of Anguilla. So what we are trying to encourage persons is that Anguilla is living in a world that's basically full of COVID, all around the world. So we're trying to educate the public that, look, we have to find ways of ensuring that, and I use this word guardedly, coexisting with COVID, right? And I think as of right now, if we do the measures where people report in early, report in quickly, don't go to work if they're feeling sick, engage in mass use in close quarters, then we think we can manage it in a way that we're managing. And we see the numbers responding very positively. We need to engage with the churches. At this point in time, we're not going to recommend to EXCO that we do any shutting down mass gatherings, because we think if we certainly follow the guidance and the regulations in place. For instance, in churches, if you wear your masks, if you social distance, we should be fine. It may mean that some churches may have to have more than one service on a Sunday. So if you can't have the 3 feet between persons and your church is small, then you have to limit who can come in at any one point in time. So if you wear your masks and you social distance, then we feel at this point in time we should be able to manage quite well. So we're going to ask the churches and persons to assist us in this regard. Keep the numbers small. Make sure your congregants wear your masks. Make sure your social distance, so that indeed persons can be protected in this regard. And we're saying the same thing to all establishments that are indoors, that are closed doors. If you have closed space, make sure that the persons who come in are numbered, make sure that they can social distance, and make sure that persons wear their mask. And I think if we can manage it this way, in addition to the other persons calling in early when they're sick, we should be well on our way to dealing with this.
Rogers, that ties in as the opposition and their program this afternoon said perhaps there should be a restriction at the bars. There are many persons liming, hanging around, being very cozy, very chill. So they express concern in that area.
Again, what we're looking at right now in terms of the kind of exposures that we're seeing indoor closed spaces and so on. Even the nature of the activities that put you at higher risk, like with the hairdressers and so on, and singing and so on that you have in a closed space, such as a church. So Right now, because of the extent of the spread and the clusters that we have identified, we are really trying not to go too draconian as yet. If these are outdoor settings, we're pushing outdoor settings as a more safe venue, and we're really just looking at the numbers. And if it comes to that point, we will. Everything is up for discussion, and this is nothing is in black and white. We're thinking about those things, and we're watching the situation very closely, and we've seen a very distinct pattern that has emerged. So we've kind of taken a step back on even suggesting certain things at this point. But point taken, and everything is up for discussion and for continuous assessment and so on, looking at the numbers, looking at patterns and so on. We're seeing these close counter spaces, poorly ventilated, and then the homes of the same person. So we're just kind of trying to balance up, for lack of a better word, you know?
Doug, since the cluster was first discovered, has there been an increase in first persons wanting to take a vaccine? And if so, we know that in a press conference previous, you said that there are 200 persons who had already gotten their first vaccine. Because of that, will there be an increase of in terms of a request for more vaccines from UK?
Well, in the first instance, in terms of putting hard numbers to the interest, I've told the last few persons to register their interest on the portal. That's the best way for us to gauge in terms of what we anticipate may be the need going on, but that would be the best way to objectively say, okay, we may need X amount of vaccines extra, because we can't go to the UK and say, well, I think I need some more. We need something more hard in terms of interest and serious interest, so we're encouraging persons to still register on the portal, and then we can gauge where we are.
Hi, from the Herald. I have two questions. One deals with the quarantine periods, and the other deals with some information about AstraZeneca. So I'll start with AstraZeneca first. You know, most of us get our news from TV that comes from the United States. So we know all about Pfizer. We know all about Moderna. We actually have to go looking for information on AstraZeneca or listen to what y'all tell us weekly. So my question is, could you give us an update, one, on the possibility or what AstraZeneca is doing with booster shots, if anything, one, and two, what the status is of vaccinations for the younger population? Is there anything that you could share with us?
Okay, in terms of looking at your sources of information, you have the NHS website, you have Public Health England, that you can get information from. I know we're mostly exposed to American media, but there are also those sources. So looking in terms of what is known about AstraZeneca, I would say those would be the most, and even WHO, because AstraZeneca is a vaccine that's being used from a large percentage of the global population because of the logistic considerations. In terms of booster shots, the general approach from the UK, not just limited to AstraZeneca, is looking in the first instance at the most vulnerable, persons with underlying immune deficiencies and the elderly, in whom the vaccination coverage, the vaccination efficacy may wane over time because their immune systems are not as robust. So that's the discussion, and it has nothing to do with AstraZeneca specifically. The discussion with the UK counterparts who use AstraZeneca and Pfizer, and I think they recently approved Moderna, is who is going to need booster shots, period, right? So that discussion is not vaccine specific at this point in time. It's about the kind of population profile that would need the vaccine. As you know, the US is looking towards boosters for everyone. So we're in the UK camp, WHO camp in terms of our guidance thus far, and the discussions are ongoing. Looking at children, we, as recently as Friday, were talking about going forward, what can we expect, because you have a chunk of our population that's vulnerable. And they are looking at even the logistics around some of the other vaccines. They're talking about candidates that may emerge in the next few months, so on. Because in the UK, to be quite frank, the AstraZeneca trials among children had been halted. They have not proceeded with those because they don't have to. They've had other options. And I said, well, what happens to the countries that are dealing with AstraZeneca? So the discussions have been around looking at any way we can get around the cold chain issues, and secondly, the other candidates that might come on stream in the near future.
Okay, so at this point in time, it's just discussions for AstraZeneca in terms of both boosters and possible vaxes for younger people. Thanks. The second question is about the quarantine periods for visitors to Anguilla. I believe if you're staying in a hotel, and whatever hotels are still open, there is no quarantine period. However, and correct me if I'm wrong, however, if you're in a villa, if you're a visitor to Anguilla and you've paid to stay at a high-end villa, you still have to quarantine for 4 days. Is that correct? I'm sorry?
It depends on your length of stay. Based on the approvals that we have currently and based on our recommendations, if you are less than a 7-day stay in a villa, there's no need of quarantine, but we'll test you at day 4, just like we're testing you at the hotels. But if it's a long-term stay where you're going to be here for more than 7 days, weeks, months, sometimes people stay longer, you'll have to stay in place for 4 days. We test you after 4 days, and then you can leave. You can leave your quarantine.
So
It is the same for if there's a visitor coming to a house in Anguilla. If a visitor is coming to visit your home, it'll be the same 4-day quarantine.
okay, so just to clarify, because there's a lot of information circulating. If you are a visitor to a villa and you're only here for 5 days, you do not need to quarantine for 4 days, but you will be tested
On
at
day
the 4th day.
Yeah.
Thank you.
Right.
Okay, but if it's 7 or more, then you have to
Yes.
quarantine for 4 days.
Yes.
Thank you.
And I can refer you to the press release that was done by the Governor and Premier last Thursday, which speaks to that.
Thank you very much for those questions. And these regulations are looked at, following the epidemiology and the science. And so every 2 weeks, we tend to update and upgrade if as needed, decrease restrictions if we can do that. And so I know there's some concern by the industry that people are canceling because they're thinking at festive and later that, these restrictions. We can't predict that. This is all based on the situation in Anguilla at the time. And so we will continue to do what we can. As you heard the Permanent Secretary say, we do take into consideration, health is paramount, but, we want to make sure that we can keep the country open as safely as possible. And certainly we want persons who are not vaccinated to register still to be vaccinated. Those turning 18, certainly we'd expect them to. And the younger ones, as we continue to negotiate for the vaccine that can survive the cold chain that we can distribute in Anguilla, then as it comes here, then we would want to make sure that persons who are eligible would register and do it. And so the parents, we appeal to them also to, to help us and cooperate in that regard. Are there any other questions for the health team? Anything online that we're seeing? If they're not, I want to thank the Chief Medical Officer and Permanent Secretary and Ministry of Health for their contributions today. I think that was very, enlightening in terms of getting the information. And also know that they have not slept for this whole past 2 weeks. And so I'll allow them to leave now so they continue to doing the testing, contact tracing, and following up on, what we're doing to keep Anguilla safe. Thank you again. I appreciate it. You have the thanks of a grateful nation. I'll take this opportunity to welcome young Mr. Brooks, son of Rasby, Valdemar Brooks, who is, at Radio Anguilla and seems to be following in his father's footsteps. And I think that will be excellent, for Anguilla to continue that legacy. So welcome. I think I saw you in high school recently when I visited when the Minister for Education made me go and teach a class, you know. So, so it's good to see the young people are, you know, showing an interest in these opportunities as they become available. The Minister of Education had a very thorough presentation on Friday last week on the schools, where we were in terms of education and a forward look towards school reopening and how that would be handled in the safest manner. So what I'll ask is that the Minister give a brief summary just to bring us up to date and for those who were not following last Friday.
Thank you, Premier. Good afternoon, everyone. As the Premier said, we would have done a press conference on the 20th of August, that's last week, Friday, detailing what remote learning, online learning is going to look like on the 6th of September, when schools are going to be reopening. If there are any further questions on that particular e-learning, we're always available to send emails to the Department of Education, but just briefly, we would have stated that learning packs will be available for students who still do not have access to laptops. We are currently working with the ANGUILLA Progressive Association of New York, APNE, and the Schultz Foundation on the donation of laptops to the school sectors. And this will do a major job in bridging that gap between students who do not have and do have. I want to thank APNE thus far for their contributions formally. They've contributed a great deal in that push to get laptops for our students at school. So we are in the last phases of getting those laptops sorted and brought and ordered. And that will help a lot, especially as we look to incorporate e-learning as a regular in the school year. But for those students who at the moment do not have access, we are encouraging them to reach out to their teachers, to your students' teachers. If you don't have, if you're not yet assigned a teacher, the teacher will be reaching out to you, or the school will be reaching out to you to give you further details. And once you get those details, you can let them know exactly the situation as it relates to e-learning, and the school will prepare the packs and let you know when the packs are ready for your collection. As it relates to online learning, we have stated that there are specific guidelines which are available on the Department of Education's website. That's both for high school and for primary school. The primary school guidelines are published at the moment. The high school guidelines will be published shortly. And these guidelines will give you details as to what to expect for your child from e-learning over the period of from 6th of September. Can't quite remember when it ends. It's about the 21st of September, from the 6th of September for a 2-week period. If you need any assistance as it relates to e-learning, we do have an e-learning team at the Department of Education, which consists of Teacher Winona, Dejanique Badois, and I get one more name. I'll remember it soon. But we do have 3 persons in the Department of Education who are tasked specifically with assisting if there are any e-learning queries or concerns for your students as they get ready for remote learning. We also have published guidelines as it relates to communication with administrators, because I realize that a number of persons say that they have difficulty when it comes to communicating with schools and getting information back in a timely manner. So we have published some of the protocols for you to access in terms of who to talk to if this is a specific concern of yours. And we're going to have a frequently asked questions list put out for ease of reference. So that is a quick synopsis of the education protocols for e-learning. You can access the entire packs on the Department of Education's website page, and I'll ask the DITES team to publish it to the Government of Angola website page for ease of access for those who do not have Facebook. For those who have Facebook, it is on the Department of Education website. And you can always reach out to your principals and your institutions directly if you need any additional assistance. Thank you.
Good afternoon, Minister. You mentioned that there will be e-learning for 2 weeks. Would that be 2 weeks in the first instance, or would there be any conditions that will warrant an extension of that 2 weeks?
Well, it's 2 weeks in the first instance, and we are looking at reopening and going back to face-to-face learning when those 2 weeks have expired. Of course, we are monitoring the situation as it relates to the COVID-19 cluster here on island. And when we are in a position to speak more definitively, and we will let you know before the 2 weeks have expired, of course, so that you have ample time to prepare as to what exactly to expect when those 2 weeks have expired.
Just a comment. I watched online last Friday's presentation, and I just have to commend the use of the slides with the information on it. It was very informative. So instead of just a visual, you could, instead of just auditory, you could get the visual as well. That was good.
All right, are there any other questions for the Minister of Education? If not, you'll have access to the presentation from last Friday the 20th, and that was very thorough in its content. I think there was a question about, Pfizer, and about how the negotiations are going. As I had mentioned earlier, we do know that one of the issues is the cold chain of getting that vaccine from the UK to Anguilla, since we don't have direct flights. And so the other option would be looking at Moderna. That has also been authorized or it has been emergency use for 12 to under 18. So these are the negotiations we are in with through the governor's office with the Foreign Commonwealth Development Office. And as soon as we know, we'll let you know. Initial stage will be to get in enough AstraZeneca doses to give second doses to those who have taken their first dose up to the end of July. And any other interested persons, also those who would have been pregnant at the time who want to get the vaccine, and those who are turning 18 in the next month or so. As I said, we are still looking into getting access to Moderna or Pfizer so that we can get vaccinated, those 12 and older, because we do feel that the more coverage we have, the better chance we have of keeping people safe if they immunize. We do know that, the young can also get COVID, and Delta has proven to be the COVID disease of the unvaccinated for the most part, who end up getting severe disease, ending up in the hospital, ending up in intensive care units, and some dying. And so that's what we want to avoid. We have a healthcare system in Anguilla that will do its best to save everyone, but we have a limited healthcare system, and the resources that we have, it would be better to utilize those for diseases, other than COVID. If we can get enough persons vaccinated, then we would not have as much of a risk as that. I did hear on the radio this morning that there was Anguillian that passed in St. Thomas or in the Virgin Islands with COVID, and we want to give our condolences to those families because, you know, just one person dying is too much. And we think that the more we can prevent this disease or stop it, the better off we will be. There was another question online.
So someone was asking online about the status of the new high school. We, of course, didn't get to cover that in the last press conference because we were going through the protocols for the reopening of schools. The new high school will not be ready for the beginning of the term in September. We will continue with the shift system in the high school system for this first semester. We do know that there are a number of contractual deadline dates to be delivered by the respective contractors, and we are looking at those deadlines, looking at whether or not there are requests for reasonable extensions, and to see exactly what is the action that the ministry and the government of Anguilla will take if those extensions are not approved. So, as I said, we won't be using the new campus because it won't be ready at the time of the beginning of the first semester, which will begin on the 6th of September. A number of the contractors' contracts are later on in the semester in any event, so we wouldn't have use of the entire building on the 1st of September, but we'll be looking to see exactly when do they complete, the implications of those completion dates. I will share that information in more detail in a special forum for where we can focus on the updates, probably at the next what we'll do is probably at the next press conference, I will give a breakdown of the completion percentages for the high school for you to know. It's probably going to be at the one after the next.
Quick question, what about the primary schools? Are they all going to open?
So the primary schools will be ready for use come the reopening of the schools physically, yes. And just for another question came in about the question about the private schools. The private schools are also being encouraged to go to e-learning for the reopening of schools. If they are in a position to go to e-learning, we encourage them to do that, yes.
Thank you, Minister. And certainly, as I said, the Department of Education is available for any questions anyone would have as we move forward. I'd like to give an update from the Ministry of Finance. And the first is that the audits of the statutory bodies is ongoing, and that started last week by Axiom International Limited, which is a company from the UK that deals with capacity building, also institutional and public sector reform. And so those audits are ongoing. In terms of the supplementary budget, we are currently working on that to see what monies are available, how we can reappropriate, having the priorities as we get to the second half of 2021. We do know that there will be a budgetary deficit. Also, one of the things I want to do is see if we can reappropriate any funds to resume the unemployment and underemployment benefit for those affected by COVID. And we do know that most, if not all, of the hotels are going to close this month. And so persons, you know, there will be some unemployment issues as we get down into the fall and last quarter of 2021. And so that's right now the Permanent Secretary and others in the Ministry of Finance and the Ministry of Economic Development and Commerce are looking at those numbers. The policy-based loan from the Caribbean Development Bank, we are currently working on the policies and also how we are advancing that so that we can get the $20 million that is necessary for us to continue providing the services which are necessary, such as healthcare and education, police, fire, and maintenance as we go forward. I just want to give you an idea of where things are as we get to the end of year 2021. Central government debt is at $446.89 million. This is at 213.75% of our debt to recurrent revenue ratio. We should be at 80% per the borrowing guidelines. Our debt service to recurrent revenue is at 23.47%. This should be at 10%. And our reserves, essentially zero reserves. Our liquid assets, and this should be at 25% of recurrent expenditure. So as I mentioned, we'll be starting 2022 with a deficit. Our debt to GDP ratio right now is at 60.57%, and the goal is to be at less than 60%. And that is a threshold that was put in place with the IMF, which recently the Monetary Council extended from 2030 to 2035 to try to come in compliance. ANGUILLA, as you can see, is at 60.57%, so we are fairly good in that regard compared to some of the other countries in the region. But certainly we are not in a good place. And, you know, I keep hearing that, you know, we are criticized because we don't tell the people, give them enough information as to where we stand as a country financially. I mean, I thought that we were doing that every time we get near a microphone and sometimes even without. But just wanted to reiterate those numbers, that we're not in a good place fiscally. We are working, you know, with what we can, with the space that we have, to keep this country open, to be able to provide the services that government, you know, has to do, to make sure that we can service our debt. Because if you can't service the debt, then you're considered to be bankrupt and a failed state. And some people would say that that's the state Anguilla has been in for a while. But, you know, I just want to let the people know that, you know, there is hope. There is a silver lining. We control COVID, which I think that we've done a fairly good job of so far. We get to open back up our tourism industry, which is our main industry, accounting for over 80% of our economy. And then we allow, you know, our Minister of Economic Development, Commerce, to develop fishing and farming and manufacturing as diversified pillars in this economy. Then I think that we will be getting into a better position. And so I look forward to, you know, 2022 with renewed hope and certainly with an understanding that we have to manage things correctly, and we are open to ideas. Nobody has all the answers, but we certainly want to make sure and let the people know that what we do is in the best interest and the well-being of the people of Anguilla. And with God's help and the encouragement and support of the people of Anguilla, we will get to the promised land where we need to be and where we deserve to be as a people. So, if there are any questions for me as Minister of Finance or Minister of Health or as the Premier of this beautiful and beloved country, then I am willing to answer.
Dr. Webster, you just mentioned that government is currently working on the policy-based loans. Could you tell us exactly what months the policy-based loan will cover in terms of having the money? And is there any truth that government actually has to borrow from Social Security in order to pay civil servants?
There's absolutely no truth to that last statement that you made, that government is borrowing money from Social Security. I've heard that being stated on the airwaves, and I think whoever put that out there is just trying to sow seeds of discontent in the minds of the people of Anguilla. Social Security paid out the unemployment and underemployment benefit to persons who qualified, those who had done, who had lost their jobs because of COVID, from April to June of 2020. Ever since then, the government of Anguilla has carried the burden of paying the unemployment and underemployment benefits from July of 2020 until the July 31st of 2021. Also, the government carried the burden of the $800 per month for those who didn't qualify for Social Security benefit at that time from April to June. And the government of Anguilla has not asked Social Security to lend any money since we've been in office. And so that is a lie. And I stated very categorically that persons who make those statements, that the intent is not in the best interest of Anguilla, and they should be shunned. In terms of the other question you asked about the CDB loan, that we're hoping we'll acquire in September, and that will be utilized. Right now, we have a deficit that's close to $25 million, and that $20 million will help in that regard. But we're still expecting that by the end of 2021 will be almost $11 million, so roughly about $11 million, $12 million deficit. We do have the benefit of having an overdraft at NCBA of $20 million, and with the Eastern Caribbean Central Bank of up to $17 million if we need to tap into that. So we do expect that as we go forward, we may have to tap into that, but we are looking forward to the tourism numbers based on the projections to be better in the last quarter of 2021 and the first quarter of 2022. We do know as we have to make these adjustments as we go with the epidemiologic situation with COVID, that might affect those numbers. But we are cognizant of that, and we are making changes as we need to protect the health of the people firstly, and then to protect our livelihoods secondly.
Mr. Premier, on another radio station, the former Chief Minister of Anguilla, Mr. Osborne Fleming, one of his suggestions to help solve the budget situation is for a cut in wages across the board. Would that be something that you'd be interested in doing?
Well, everything has to be considered. You did hear in that presentation by the former chief minister I supported some of the things he said, and a lot of what he said I didn't support. But one thing he did say that, if he was in this position, he wouldn't know what to do. He said that multiple times. And so, I certainly, I think he was very honest in those statements, that he felt at a loss as to what to do next. And so I appreciate that he appreciates the situation. But no, he did talk about cuts, and I am not in favor of that. Certainly everybody has to make sacrifices. We have, made the hard choices to preserve the services that are provided by the statutory bodies. We had to raise the fees in health care, water, the ports. But I have said, and I still stand to that even though prior to the last administration demitting office, that they put in that to have the opportunity to cut the civil service and do 5% cuts, I feel that the economic scarring that we would have and the social degradation that would occur if that happened is not something that Anguilla can survive. And so I am not, and this cabinet is not in favor of doing any salary cuts at this time. It would only be a last resort if that became necessary. But at this point in time, I think that there's so much of this economy is based right now, the survival of NCBA, where civil servants, statutory body employees who have loans, the Anguilla Development Bank, the pension fund itself is dependent on the contributions of the public servants, Social Security right now. And so I, feel that, that would be cause for severe alarm in Anguilla. I understand that the former chief minister talked about he did 8% cuts, but that's after he had raised, all the salaries, 15% at one time. Their salaries up almost 25% at one time, and then another 10%. And so to make the 8% cut he talked about was necessary to keep the country going, especially when we got to the point of the global financial downturn. The chief minister, Mr. Hughes, also had to make some cuts when he came in. But I think that, given the level of economic depression that we have been in, these austerity measures we've been in since that time, I think that it would be detrimental to this country to go to that level. And I think that is shared by the administering powers also. And that's why we find that it's necessary that they provided the financial assistance for COVID relief, the up to $100 million that they did, so that we would not have that type of scarring to the economy, so we could provide the unemployment and underemployment benefits, so that we could have money to keep the hospital open, expand the lab, so we could do testing, so we could develop protocols to help the tourism industry, even though we didn't get to the levels that we wanted it to, that we were able to get some funding to help that along. And we may have limped this far, but certainly I can feel that we're getting stronger, and the people are coming along because they understand that we deserve to get that chance to save this country, and that is where we are. And we're looking out for those who are vulnerable, who are very young and are old, and those in between. We want to help as much as possible to get us past this COVID, past this economic depression, to a state where we have progressive, sustainable economic growth. And by doing that, we also preserve the health of our people. Any other questions? Well, I want to thank you all for coming today, and certainly, you know, you got me a little excited today with some of the questions, and you know, I think that what I want people to leave with from today's press conference is that you have a government that is working, a government that, you know, people talk about, oh, you know, you guys should cut your salaries another 30%. You know, you should cut the civil service, you know, salaries 10%. But just think about it. Think about who is carrying this country right now in terms of sustaining, you know, the economy, being able to keep the supermarkets open. It is, you know, the public servants who is paying the loans at the bank, who is, you know, maintaining the ANGUILLA Development Board, who is, you know, making sure that the extended families are supported. You know, certainly we got some relief in July and August. We were able to get over 6,000 visitors into ANGUILLA, and thank God we were able to get that done with only, you know, if you add up the 41 cases from this cluster and the other probably 10, 15 cases that have come in, I think that we've done fairly well. We have to thank God for that and thank the people of ANGUILLA, the hospitality workers who have followed the protocols, who are protecting themselves and protecting others, and those of us who got vaccinated. And that's what I want to say, is that it's because those of us and you who chose to get vaccinated, that is what is keeping the virus from spreading like wildfire through this country as it has done in other countries. And we only have 58% of us that are fully vaccinated. That is, had the 2 doses, you know, more than 21 days after the second dose. I want to thank those who have chosen to be patriotic and to do that. Though the rest who have gotten only their first dose, thank you also. But those who are eligible to be vaccinated, who are not being vaccinated, you know, you're probably the ones who are out there saying, you know, shut down the country. We're not going to do that. We will be careful. We will be methodical. We will do it to make sure that we protect the lives of the people of ANGUILLA. But we certainly are not going to be dictated to by those who do not do the right thing. And so that's the message I want to send today. Still, sign up, register to get vaccinated when the vaccine comes. And parents, I'm asking you to allow your children to be vaccinated when we have a vaccine that is cleared for those who are younger than 18. So may God bless you, and may God continue to bless ANGUILLA. I thank you again for listening and for participating. Be safe.